afternoon, everyone. Welcome to the April Advancing Throughout the Year webinar. Today's topic is supporting community health worker success, the collaborative approaches to training, development, and implementation. Some of you might be a little familiar with Advancing Throughout the Year, but just to give a little background, LiveWell San Diego works with recognized partners to host a series of webinars and networking events that build on the topics and connections made at the annual LiveWell Advanced Conference and School Summit. So we are here to stay connected, share new insights, learn from our community partners, and continue the important work we start together. So in just a minute, I'm going to go over just a few things to keep in mind before we begin. This webinar will be recorded and available on the Virtual Connection Hub or VCN webpage. So we just ask that you do not use AI note takers for this meeting. Instead, our team will be taking notes and share a summary to all of those who sign up via the link shared in the chat or by scanning this QR code on this slide. Your lines will be muted for the duration of this webinar, so if you have any questions, please enter them in the Q&A box, and we will be answering those at the end of the presentation in the order in which we receive them. If due to time restraints we do not get to your questions today, or if you would like to reach out to our team, please feel free to follow up with us through our email address listed here, and we will also provide that in the chat for you all. Moving on to our agenda. Our agenda for this webinar will start with a welcome and introductions of the facilitator and panelists before moving on to our panel discussion. The panel will wrap up with a Q&A session, and then we will share the link to our feedback form where we encourage you all to submit your comments. And then after that feedback form, we will conclude with some announcements and closing statements. So to introduce our facilitator for today's panel, she is Jeanette Barragan, who is the Chief of the South and Central Regions in the Department of Strategy and Community Engagement. So Jeanette, over to you.
Thank you, Lauren, and good afternoon, everyone. Thank you for spending this afternoon with us. Thank you for joining us today. Today, we're excited to bring you another Advancing Throughout the Year LiveWell San Diego webinar. Just a little bit about myself. My name is Jeanette Barragan, Chief with the Department of Strategy and Community Engagement, and I lead several community health worker initiatives and projects on behalf of the County of San Diego Health and Human Services Agency. This afternoon, I'm honored to serve as the moderator for today's panel, Supporting Community Health Worker Success. We have a dynamic cross-sector group of panelists joining us to share their perspectives. Well, each of them bring an impressive background and bios, which will include their bios in a follow-up recap email. What I want to highlight for today's conversation is the collective experience they represent. Together, they bring years and some of them decades of experience developing CHW training materials and programs. And they have trained and deployed hundreds of CHWs collectively throughout the region to serve and support our diverse communities. Although each panelist works with CHWs in different settings and contexts, they are all connected by a shared commitment to strengthening the system that supports CHW success. I'm especially excited to see this group of panelists come together again. In many ways, it feels a little bit like a reunion as we had the opportunity to collaborate over multiple years with each of these partners on the development of the county CHW training curriculum and the CHW Training Academy pilot program. Today, we use that conversation that builds on this shared experience. We'll take time to reflect on what worked well on that collaboration and the lessons learned through that process. But more importantly, we'll zoom out and use these reflections as a launching point to explore broader best practice across three foundational pillars for CHW success, which is training development, training delivery, and workforce deployment. So let's dive in. To get us started, I'll love to invite each of our panelists to briefly introduce themselves. So please share your name, the name of your organization, a bit about your current role, and quick note on how your work connects with supporting CHW work, and also how were you connected with the either the development, the implementation, the deployment of the county CHW training curriculum. Let's start with Daisy.
Thank you, Janet. Good afternoon, everybody. My name is Daisy Merino. I'm a migrant health and outreach program manager at Vista Community Clinic. Under the community health department, so we have the clinical arm of VCC and the programmatic. So my role in my work is on the programmatic end, and my work in the CHW effort, it's because under my migrant health program, I actually support a small group of promotoras with whom I've been working for the last 5 years and whose history goes all the way back to maybe close to 20 or more years. I'm doing promotor CHW work in North County, San Diego. And I'm also part of the San Diego County Promotoras Coalition, where I support as a secretary. Thank you.
Margarita, would you like to go next?
Certainly. Hi, everyone. Buenas tardes. Good afternoon. My name is Margarita Holguin, and I am the founder and president of Consulting Solutions LLC. Some of you may know me in my prior role as either with Health and Human Services for over 20 years, or more recently with the Chula Vista Community Collaborative in Chula Vista Elementary School District for 13 years. As Consulting Solutions since 2020. I work with the community health worker and the promotores model since about 2007 and managed dozens of community health worker and promotores models, including community, school-based, clinic-based, outreach and research-based projects. I developed the first CHW training, which at that point we called it the Promotores Academy in 2009. Since then, I've developed numerous trainings and have trained hundreds of community health workers and promotores in San Diego County, nationally and internationally. For the County of San Diego Community Health Worker Training, my role was the lead for the development of the content for the training. Thank you.
Thank you, Margarita. Tanya, do you want to go next?
Yes, absolutely. Hello, everyone. Good afternoon. My name is Tanya Penn. I work at San Diego State University's Institute for Public Health, where my focus is on community-driven research and workforce development. So I also direct the Center for Empowerment and Community-Driven Research, or CEDAR, where we partner with communities and industry to strengthen systems in ways that reflect community priorities. So my connection to community health work is centered around supporting, training, and sustaining the CHW workforce. I've worked on developing and leading programs that recruit, train, and support CHWs to respond to public health needs, including during the COVID-19 pandemic. For the CHW Training Academy project, I served as the project director or principal investigator with the primary focus of implementing the San Diego County HHSA CHW Training Academy, full name. And in this role, I work closely with the county, with Margarita, the Consulting Solutions, with the San Diego County Promotores Coalition, VCC, kind of all of our partners, right, to ensure that the Academy was peer-led, accessible, and aligned with the core competencies and the evolving state requirements. Thank you.
Thank you, Tanya. And last but not least, Amanda, do you want to go next?
Hey, thank you, Jeanette. Good afternoon, everyone. It's a pleasure to be with you all. My name is Amanda Schultz, and I'm the former director of the San Diego County Promotores Coalition. At this moment in time, I'm currently working with Kaiser Permanente as a community health manager. But I think one of the things that has been wonderful is that in all of the different roles that I've been able to serve in, I've had the opportunity to engage with community health workers, whether it was developing training, trainings or creating opportunities for community health workers to connect with different employment opportunities or strengthening workforce development, including the organizations that were then supporting and housing those community health workers and promotores. So my work has gotten to span through multiple states and I think 4 different countries. And I think that across all of that work, there are so many common threads in seeing the incredible power and strength of community health workers and their abilities to really represent and connect their communities to resources. So I'm really grateful to be here with you all. The Promotores Coalition had the opportunity to work on this contract or this partnership through CHW deployment. And so we managed a contract that worked with 3 different community-based organizations that provided services, community health worker deployment across the 3 super regions for the county. And we worked on a variety of different projects where we were able to engage community health workers that had unique lived experiences and languages and community connections to hopefully bolster the county's community health outreach efforts. Thank you.
Thank you. Thank you for those introductions. I'm getting excited just with the introductions. It is clear that we have a wealth of experience and perspectives on this panel. So let's dive into our first topic, and that is training development. So drawing from your experience, especially thinking back to the development of county CHW training curriculum and beyond. So we started from scratch, right? So what was the approach in designing the CHW curriculum during that time? Daisy, do you want to take this one?
Yes, of course. Thank you so much. Earlier, I forgot to mention that BCC was part of the initial development of the curriculum and also the piloting. And the approach prior to its launch is working closely with the partners that were previously mentioned. And not only that, but also centering the voices of promotores and CHWs across San Diego County. So that meant conducting focus groups in both English and Spanish to really assess the promotoras, the CHWs, and really get to learn about them and their knowledge, their capacity, and their training needs. I'm sorry. And these focus groups were conducted across San Diego County, like I said, which included the larger network of San Diego County Promotoras Coalition. We also work with our group of Poder Popular at Vista Community Clinic, which is the group of promotoras that I've been working with closely for the past 5 years. And through this focus group, we also we wanted to know about their learning styles. We wanted to know about the skills that they needed at that time, their capacity, their years of experience as a promotor, CHW, and their understanding of concepts like social determinants of health, trauma-informed care, and what their thoughts were on what were some basic important health concepts or topics. And this input that we collected from them really supported us in learning what was the need out there, right? Because in order for us to really develop something that was going to be not only supportive of the CHW promoter community, but also something that they were telling us that was needed as part of the curriculum. And part of that approach also included us doing research about what other curriculums were out there because we didn't want to duplicate any of efforts. On the contrary, we wanted to make sure that that this curriculum was going to be supportive of their current efforts and future efforts to come. And something very key that was to also mention here is that this was happening also during the peak of the COVID-19 pandemic, so around that time. So during that time, something that we were learning as we were conducting the focus groups is that promotoras were telling us, promotoras have been here all this time. It's not a new concept, it's not a new term, but because of the pandemic, now suddenly, right now, everyone is talking about promotoras, right? So for them, this was something that we wanted to make sure that in in co-creating this, we were taking we were being mindful of how we were bringing this to them, and that it included their voices, their experiences, and what they were telling us that they needed in terms of skills and in training needs, right? So that was our initial approach, and that's something that I know BCC supported with. And like I said, I know Margarita, you were also part of that implementation phase. If there's anything that I'm missing here, just please feel free to jump in. But those were the initial components of this development. Thank you.
Thank you, Daisy. Really helpful context. And I almost forgot, you're right. This was in the midst of the pandemic, and it was clear, it became very clear that there was so many layers of consideration to really center the CHW voice in the work. So we really thank you for that. So building up on that question, and this is for Margarita, in your experience, what were those essential non-negotiable elements that must be considered when designing or developing CHW training material or program, such as the curriculum?
Well, there were certainly several essential and definitely non-negotiable elements that have to be considered. But since I guess we all have to go home tonight, we'll just share a few of those. And I think that of the most importance was that we wanted to make sure that this training was anchored in the framework of the National Core Competencies that really truly outline the 11 core skills and the 10 core roles that defines a scope of work for community health workers. So we needed to make sure that everything that we did, all the training, integrated that fundamental training and the intended objectives of those core skills. So all the academies and all the trainings that I've developed since 2009, when I began to do this, have all been based on these core competencies. And the county's Community Health Worker Academy was based on the most updated national standards for these core competencies. So that was a must be and a non-negotiable. And as Daisy mentioned, it was important for us to make sure that this was co-designed and that we had the opportunity to go to the people who know this work, right? The community health workers, and hear from them through these focus groups that Daisy mentioned. And we heard from them and we shared what we were thinking, and they were able to provide us their ideas, their input, and use that to really anchor everything and make edits as needed. So really hearing from them, making sure that we had their voices and their experiences designing the curriculum throughout. So their opinions really guided what we were doing. We also wanted to make sure that the training was relevant, and it was something that the community health workers were going to use every day. So recognizing their experiences. One of what makes a community health worker, a promotora, what they are, is their lived experiences. Our lived experiences, as I am a promotora myself, is what makes us who we are. And so being able to use those real experiences, real world cases, is really what matters. So we use those real case scenarios, real life experiences. And I worked on several of these projects. We were able to use real role plays and from the experiences that we had, really put in the work that we do every day and be able to role play that. And so in any training with community health workers and promotores is being able to allow them time to share their experiences, to learn from each other, to be able to speak up and mention what they experienced when they were doing the work or in the things that they do every day. So we wanted to make sure that that was an opportunity to do that throughout the training. And lastly, I think that what I'll mention is that we wanted to make sure we had the right partnerships and the right people to do this, not thinking that one organization can do it all. Vista Community Clinic recognized that well and brought in Consulting Solutions for Content, brought in Arboreta Group, partnered with the great San Diego County Promotores Coalition, Know the County. Several of the organizations that are involved with the coalition were part of providing input and really helping, get everyone to the focus groups and all of that. So it was important to make sure that everybody was at the table, Family Health Group, all those wonderful partners that are so loyal to the coalition were part of getting their input and just recognizing who is good at what they do and who knows the community. And I had been training promotores for many, many years. And so just getting the people who had the expertise to do what they do. So that was part of our approach. Thank you.
Thank you, Margarita. And as I'm hearing you with all the partners and the collaboration, it just brings me back to that. It was so beautiful to see so many great conversations and so much intentionality that went to it. It really makes me proud of the collaboration in the journey. So as you mentioned, we can spend a lot of time on just the design of the development of the material and the curriculum, but let's explore what goes into from the design into designing an effective curriculum. So now let's move into the next phase, implementation. So shifting from how it comes to life in practice, specifically how training is implementing and deliver. So this question is for you, Tanya, related to the CHW Training Academy pilot program. So what can you share about the implementation process in the deployment of the County CHW Training Academy? And feel free to mention the successes, but also the lessons learned.
Great, thank you so much. So our approach to the CHW training was intentionally multi-layered and really grounded in partnership. So our work at SDSU, we focused with three core components for this program, and it was around the CHW Training Academy. It was not only about the academy, right, and training, but then also about ongoing continuing educational seminars. And then finally, it was about supporting the infrastructure for the San Diego County Promotores Coalition. So together, all these pieces allowed us to build skills, provide that ongoing support, and then strengthen the CHW workforce, countywide. So the Training Academy itself, so I'll start with that. It was, the foundation. And our training model, we delivered it in two parts across multiple training cohorts. And we'll kind of get into that second half later. But the Academy focused on 7 core competencies, the initial one. And as Daisy mentioned, Margarita, they're the ones who developed it. We just took that curriculum and we implemented it. And some of across all parts of the academy, we used the peer-to-peer training model. So for all sessions, they were facilitated by the community health workers. And this was very intentional, this decision. The peer-to-peer model centers that lived experience, that shared language and those cultural connections. The experienced CHWs led the discussions and the skills sharing with newer CHWs, and they drew directly from their community work and helped problem solve, with the communities themselves. So the training didn't end just with the academy. As I mentioned, we implemented the continuing educational seminars to support the CHWs over time and be able to respond to emerging public health needs. As Daisy mentioned, it was developed during COVID-19. So the county really wanted us to continue that education and make sure people were educated around those regular updates by county experts. as well as the emerging and seasonal issues such as like Mpox. When that came out, we had presentations on that, and the flu and RSV, hepatitis A, Legionelles. But we also did offer seminars on broader topics, such as the adverse childhood experiences and food insecurity, cancer prevention, and we had some seminars on career development. Across that, accessibility was a priority for all our continuing educational efforts. So to ensure that meaningful participation, we provided simultaneous interpretation from English to Spanish during every seminar, creating that inclusive learning spaces. So lessons learned. So we really saw the value in that hybrid training model. So, and the importance, obviously, of offering the sessions in both English and Spanish. So we had cohorts that were English only and cohorts that were Spanish only. Our hybrid approach, we were able to have the first and the last sessions we held in person, really trying to build that trust, those relationships, and that group cohesion while conducting the remaining sessions virtually. And this allowed CHWs to participate more easily while balancing work, family, community responsibilities. Childcare came up as a real need. So having that virtual aspect was really helpful, and one of those lessons learned. Overall, our approach was, the CHW training was peer-led, accessible, and then supported by the strong community infrastructure that not only builds the individual skills, but strengthens the CHW workforce in that sustainable, meaningful way. Go ahead and go to the next slide. We do have a little bit of our outcomes. So the Training Academy, we had 14 training cohorts. 7 in English and 7 were conducted in Spanish, with over 147 CHWs trained overall. Of those who attended at least one session, we had a 92% graduation rate. And then for our continuing educational seminars, we had over 333 participants that participated in those. And then kind of overall, just some high-level evaluation results is that 100% of our participants rated the training excellent or good, and that was 81% stating that it was the trainings were excellent. So overall, really the program, we feel, really enhanced participant skills across those core competency areas.
Thank you so much, Tanya, and that really highlights again all the intentionality and all the layers. I do remember the continuing education piece tied to it was a huge success because we open it up also not just the folks that have gone through the training through the academy, but just to the broader, the more experienced CHWs that needed that extra support. And so we're gonna move to our next section, but before moving on to the deployment, I do want to add that we conducted a formal evaluation that was conducted by a separate contractor with great outcomes. But also as we implemented this training, we also continue to learn and refine along the way. And so the curriculum has gone through some enhancements over time. So to particularly to strengthening the core competencies and in ensuring alignment to the needs of the CHWs in the community. So let's take parentheses and talk about those enhancements and those and the core competencies. So this question is for you, Margarita. What strategies were implementing to ensure alignment with the 11 core competencies, and how were these approaches structured to meet the state requirements under Colleen?
Of course. So as mentioned before, that was of the utmost importance to make sure that we followed those core competencies, and that is a requirement of CHW training. So we looked at each of these core competencies. And you can see them listed here. There are 11 core competencies, and we cross-reference each of them. And each of the core competencies then has its intended objectives. And really, what are we intending to do with, per se, communication skills? And so we looked at then at, okay, so we are going to have a communications class, and are we meeting the same objectives? So we did a curriculum mapping to cross-reference each of those core competencies and make sure that we had all of what we needed to achieve within the new curriculum and the new topics that we were teaching. So that was done initially to even design each of the components of the training. And then when we looked at CalAIM, we know that for CalAIM, some Medi-Cal recipients are eligible for enhanced care management services, or ECM services, and some community health workers are providing those ECM services. So those may be services that are a little bit different than the usual work that community health workers may be doing out in the community or working at schools or even other clinic services. So, for example, through CalAIM, a community health worker working on ECM services may be doing community support services, and that may be something like helping with housing navigation and helping someone find housing, or find shelters and those types of things. So we wanted to make sure that some of the skills that we were teaching included some of what is needed for that type of work. Helping manage care plans is part of what they may do. So we included training components, as you said, in some of the enhancements that we were doing that supported CHWs that may be working in CalAIM. I would say that a lot of what we did, all these core competencies, as you can see them there, would support any community health worker that is working in CalAIM. But specifically, we do have service coordination, which is something that a community health worker working in ECM in CalAIM would definitely need to be able to coordinate all the different services that a patient may be receiving, and those system navigations and all the complexness that we make into our systems, and being able to help clients and patients navigate that documentation, and really being able to document all the things that they do for the billing, because we know that billing is critical. And definitely those interpersonal skills and communication, so that they're able to really get all the information from the patients and pass it on to all those that need to have that information. So those were some of the things that we knew that we wanted to put in there to be able to cover some of those requirements and the work that that ECMs or CHWs working in the ECM as part of the care team may benefit from.
Right. Thank you, Margarita. And this is just to set the stage for deployment for their next phase. And this probably it's an unfair question for you, but what kind of skills or core competencies are most critical to ensure that CHWs are fully prepared to perform in the field from day one? And I know it's hard to pick just a few, but if you get to pick a few, what would you say?
I do think that it is a little bit different depending on the work that we're doing. And when I began to work with community health workers, one thing that I found, for example, back in the day, one of my first contracts for a community health worker was the Red Cross. And this was after big fires in San Diego. And they would come in and they brought us training about the fires, about the Red Cross and all the great work that they do. And then we worked with another organization, and they brought us training about what they do and what messages they wanted us to carry out. And that's when I began to say, well, so everybody trains you on the work that they do, how to do their work, but who trains us on how to do the communication, how to know how to get out there, how to know how to collaborate, how to know how to really build trust and talk to people and know where you have to get in and out. So I say that the most important skills are really those soft skills, those interpersonal skills and know-hows. So having that active listening and that empathy to be able to build trust, because a community health worker is always taking messages out, whether it's a one-on-one to a client, to a patient. You may be talking to them and you really want that whatever you're telling them to resonate and for them to trust you enough to hear you and to believe you. So you have to be able to have that listening and that empathy to build that trust. You have to have those advocacy, and I call it assertive advocacy skills, to make sure that you know how to navigate those systems and you're always speaking up for your client, for their needs. And finally, I'll say collaborative problem solving, because we have so many great programs out there, wonderful organizations. There's many of them here. And even within your organizations, you guys provide so many services that sometimes we don't even know all the services that our own organizations provide. So, we cannot work in a vacuum. And so being able to bridge those gaps between the complex needs of our clients and the complex systems that we work with, and being able to make sure that our clients have access to all of those. So those soft skills on how to do that, not necessarily do A, B, and C, fill out the form this way, but the soft skills to get to do all of that.
Well said, Margarita. I'm glad I asked that question. And that's where our CHWs shine, and that's what makes a CHW a CHW. So we already talked about CHW training in terms of developing the training curriculum, delivering, implementing it, and then straining it over time. So let's not turn into deployment. How all this preparation translates once CHWs are out in the field and serving our communities. So Amanda, I'm gonna turn to you for this one. Can you provide an example or examples of how the CHW training was translated into impact during deployment?
Absolutely. Thank you, Jeanette. And I swear that Margarita and I did not coordinate on our responses to this question, but I think they flow really, really well and just attest to the critical role that community health workers play and and those unique skill sets that they bring to the work. And so, I think the community health workers that we engage with deployed a variety of skills related to those core competencies and the placements that occurred during our partnership with the county. And the example that first came to mind was really around communication and interpersonal skills, and thinking about how their cultural humility and capacity to connect really relates to the work that they do as community health workers. And so one of the first and potentially most significant deployments in our partnership was around the engagement of community health workers to support one of the county's migrant welcome centers. And through this unique collaboration, we were able to engage community health workers who spoke roughly 8 different languages to support sometimes more than 1,000 migrants per day that were transitioning through San Diego in this welcome center, and really to their final place of origin. And that our community health workers' ability to connect with individuals and really think about coming from diverse communities was critical to ensuring that everyone received that support that they needed, whether it was food, shelter, clothing, medical care. In some cases, community health workers even supported with transportation coordination. And I think, just to give an example, that capacity to communicate and think creatively was paired with on the site, on the job training, as Margarita was referring to. So we were able to equip the community health workers with technology so that in the off chance that they didn't necessarily have the capacity to speak the language of the individuals they were interacting with, they hopped on Google Translate and worked through those scenarios. But it was really an incredible experience that ultimately resulted in us connecting with and serving more than 60,000 individuals. So it really was an impactful and unique opportunity for our community to step up.
Wow, I almost forgot that whole piece, but the CHWs were put to the test on from a pandemic to this large scale deployment, and they came through and shine in every way, and just it was so impressive to see. What were some of the common challenges that came up during deployment? Not only this deployment, but any deployment. What are some of those common challenges, and how can they be addressed?
Sure. Well, and I think maybe it's helpful to provide some context to the viewers for today's webinar, in that the CHW deployment in partnership with local government was, I think, a new, and correct me if I'm wrong, Jeanette, but it was a new concept when we started the contract. And so more than anything, I think the challenges that we collectively confronted during the process were related to the kind of quick learning and recalibration that results from building something new together. I really appreciated from the beginning of this partnership that everyone from the county, our county contract manager, to the coalition, to our partners, we all went into this experience with the understanding that we were trying something new that could potentially help us identify new ways of working together in the future, in ways that'll strengthen our programs. So I think, one of the largest challenges that we confronted was identifying opportunities to engage and deploy community health workers to expand the capacity and community impact of county offerings in ways that, one, leverage the strengths of the community health worker role, but two, also were developed, with enough of an on-ramp that allowed organizations time to identify, or in some cases, recruit the workforce that we needed to best support this work. And so I think, that was a fantastic lesson learned as we were working together to think about what does it really mean to engage community health workers? What are those unique skill sets that they bring to the table? And how can we think about framing engagement in ways that really leverage their strengths, and support our kind of collective capacity to build up the workforce that's needed? So I think ultimately one of the things that I most appreciated about the partnership was that we were really able to work through, all the little hiccups and learnings with a trust-based and open conversations that created space for our organizations to learn and grow. And I think because of that, we were collectively able to be really successful in getting community health workers out into new environments and scenarios where they put those skills immediately into work and maybe built some new ones along the way.
Thank you for that, Amanda. And I really appreciate all those conversations. I know you and I were on the phone, promise trying to, merge two systems to support also the CHWs and get the work out from all these processes that the county has to merge and support a very grassroots model, but also understanding how the needs of the community, how can be more efficiency and stay up with capacity. And so all of that, it was just beautiful to learning experience, but we couldn't not done anything without the amazing partners here. And then Amanda, you were just wonderful in communicating and being transparent as to, the ups and downs of our journey. So, one more question for you before we'll go to the next one. Can you describe what effective CHW deployment coordination looks like across partners and systems? And I'm asking this, and maybe Daisy can jump in on this one too, as the San Diego Promotora former director, and now Daisy connected with the San Diego Promotora Coalition. You guys do a lot of deployment and coordination with different organizations and have a big network. So how in your experience, how does deployment coordination, effective deployment coordination looks like?
All right, thank you. Yeah, I mean, I think if it's done right, coordination might look different from system to system. And so I'm really curious to hear Daisy's thoughts on this as well, and that she's worked with a variety of different systems. But I think what made us particularly successful was that we based our engagement on the unique needs of the partners and the communities that were involved. And so, some of the best practices that I think we collectively learned along the way was it really started with early and often communication. And that communication helped us build kind of clear expectations, develop agreed upon processes and timelines. And in some cases, we created some potential contingency plans, right? These were pilots and we were trying new things. And so there were times that maybe something didn't quite work, but we had a backup plan or another approach that we wanted to try out and test. So this, early planning paired with our regular check-ins on progress, pain points, opportunities were really critical in our ability to build this new partnership. And I think just being available to bounce ideas off of one another and check in was incredibly helpful in building out these systems on our side and for the community partners that we worked with. And also just really want to give a shout out to the community partners that we were able to engage with, and their willingness to try something new and be flexible and explore. So we were able to work with MAC Project, with SBCS, previously known as South Bay Community Services, and then with Somali Family Services to do this work. And they were all incredibly flexible in the way they engaged and supported the work. So yeah, I think those were our primary takeaways.
Daisy, anything to add?
Yeah, thank you so much, Amanda. Those are really great points. I do know that from our experience at the San Diego County Promotoras Coalition, just like Amanda was saying, we do offer a variety of opportunities for the CHW promotoras to continue getting involved, whether that is by joining one of our committees, by attending our conferences, by providing feedback on the programming that is developed through the coalition. So that can look like, workshop opportunities that they might be looking for, or any other opportunities for professional growth, personal growth. We just recently had our 2026 Adelante Promotoras conference earlier actually mid-March, and a lot of the workshops that are provided there is based on the feedback that we receive from our promotoras and CHWs at the meetings that we have. So I think that that's one way in which deployment continues to be successful, by keeping them engaged, ensuring that they're part of the community, that they're providing feedback, that they're providing guidance, and that is very centered to their needs and their experiences. we continue to encourage that they also join the committees that I meant that I've said, because that gives them another opportunity to continue being part of that space. And from our efforts at Vista Community Clinic, coordination really takes a very unique approach. Like Amanda said, like every agency, I think, has agency to essentially discover or learn along the way from our perspective or from our experience. It does take having meetings every twice a month, engaging them in our food distribution efforts, supporting with childcare as needed, ensuring that we're coordinating interpretation, whether it's because they're going to be part of a meeting where they want to really express um, what is it that they want to see at their local government, for instance, so ensuring that there is that translation provided for them. So supporting the coordination of that, supporting transportation as well. For the Delante Promotoras Conference, we our agencies, or the program that the group is currently under, is grant funded. So every year, management really takes that in mind, and because we want to ensure that we are able to cover registrations for conference for their participation in the conference, we ensure that as we are looking for grant opportunities, that we include them as part of that proposal. And lastly, I would say, and coordinating that transportation as well. So I'm running out of time, but I think those are just some ideas that are coming to mind as I think about the coordination aspect behind that workforce. Thank you.
Thank you, Daisy. And we can stay in each of these different pillars for a long time, but I really appreciate the context and the insights. So just wrapping up before we open it up for Q&A. So just looking ahead, the question becomes, how do we keep this best practice, or this work that we share together sustainable, so that sustainability of this work. For the CHW Training Academy, we concluded the pilot, and it concluded along with the funding. But as a county, we're very proud of the product and the lessons learned, and we're currently actively in conversation and exploring partnerships with new collaborations that can help sustain the curriculum and training efforts, even if it doesn't look the same way, but it just keeps evolving over time. We had an excellent partnership with the UCSD to support some of their efforts. We're exploring a collaboration with San Diego Wellness Collaborative and with NAMI, so more to come on that. But on the topic of sustainability, this question, if some of you can answer this question, what will be the greatest opportunity to expand the CHW success and capacity if resources were unlimited? Because I know sometimes resources can be a barrier.
Happy to go. So I think it's about sustainable reimbursement. I think is foundational for expanding CHW capacity, because boom funding is reliable and not tied to short-term grants. It allows for organizations to hire, right, CHWs long-term, pay them equitably, and reduce that burnout and that turnover that can happen. But at the same time, though, I feel that building infrastructure matters just as much, right? It means investing in that supervision and the training, those documentation systems, the career pathways, and organizational readiness. I just think those are going to be critical for community health workers and that sustainability moving forward.
Thank you, Tanya. Anybody else?
Can I say, did it? I think, yeah, I agree wholeheartedly with what Tanya just shared. And I think just to build on that technical assistance piece for community-based organizations that are engaging community health workers, as we see more funding, sustainable funding for community health work, which is fantastic. I think there are a lot of organizations that may be new to engaging community health workers. And so I think that need for understanding and engaging in the community health work kind of culture is very in ways that maintain the integrity of the model and its ability to be effective in reaching underserved or historically disinvested communities is really critical for the benefit of the organization, for the community health workers themselves as individuals and employees, and for the communities that we're serving. And so I look forward to continuing to see. I know there have been a lot of great resources that are already out there, and I think there's still more that we can do.
I also want to mention that I think that, for example, this training that was done and the San Diego State University was able to open up for people to be able to participate was an excellent example of collaboration and things that really provide an avenue for the community to be able to take advantage of. So I think collaboration among different partners is important and can help support this. Since 2022, now we have a funding source for community health workers because we can now get reimbursed. So I know that a lot of times we're looking for free training, but training is an investment for organizations to be able to bill Medi-Cal for reimbursement of their work. But I do think that support of organizations is what it's important. Being able to support organizations to learn how to bill Medi-Cal, to learn, and it is difficult. I've done that before, and it's difficult, and you have to know the right codes and all this. And so supporting the organizations that are already billing Medi-Cal to be able to continue to do that and to increase their capacity to do that. And then the smaller organizations who are scared of billing Medi-Cal and who may think that's just for the big guys. So I think that would really help support the work of community health workers, which ultimately is about making our community healthier. That's what we want to do. We want them out there really supporting patients and people to be making better choices for health and wellness.
Thank you, Margarita. And if there's no more comments on that sustainability piece, I would like to open it up for questions. We did receive some questions in advance, and there's a few questions as part of the chat. So I'll do my best to alternate between questions in the chat and the ones that we received in advance. This one's received. One of the questions that received during registration is, how can CHW support local educational agency Medi-Cal billing option program, Leah Bob, and the Children and Youth Behavioral Health Initiative programs? Can they bill for their services? Does anybody know?
Well, I can take that. An LEA is in a local education agency that may be, for example, a school district. So a school district may be able to bill for Medi-Cal for CHW services, but the CHW has to be working under a licensed practitioner who in writing makes a recommendation for the services that the CHW is providing in order to be eligible for reimbursement. And obviously the CHW has to meet the requirements such as the training to be able to be eligible for reimbursement. And as far as the CYBHI, which is the Children's and Youth Behavioral Health Initiative, an LEA has to be an approved CYBHI provider. So if a school district is not approved already by CYBHI, Children and Youth Behavioral Health Initiative, then they cannot bill for CYBHI. So if they are already approved by that program, then they may be able to bill, but they're not billing as LEAs. They're billing as CYBHI. And they have to use a different billing code 112, which is much better because it's more straightforward. It's a fixed fee for service published rate. It's easier, but you can only bill for behavioral health services under the CYBHI, which is community health workers providing wellness and education and skill building services. And when I read that, my mind opens to all the work that CHWs could do to support that. So hopefully that helps answer that question.
Thank you. I'm glad you had some context on that, Margarita. This is another question that I think it would be important. It's a level setting question. To be recognized as a CHW, is it necessary to have certain training or have the certification or a certificate in San Diego County? Who wants to take this one?
Can you repeat the question, Jeanette?
So to be recognized as a CHW, is it necessary to have the training, the CHW training, a certificate or a certification to be a CHW in San Diego County?
So no, you don't have to have, there is no certification at the state level. In the state of California, there is no certification of CHWs, and you don't have to even do the training. The training is only a requirement, and not necessarily this training, but the training that the state requires, which this training qualifies for that, to be able for the organization that you work for, bill for Medi-Cal. But if you work for an organization that does not bill Medi-Cal, or you don't provide the services that are not billable to Medi-Cal, then it doesn't matter. You don't need this. This is not necessary. So the training that the state requires, that a CHW that is providing a Medi-Cal benefit, so a service that is eligible as a Medi-Cal benefit under the various programs, that CHW has to have met the requirement of the training that is approved by the state. So hopefully that answers that question.
Thank you, Margarita. The next question is also Medi-Cal billable services. What areas do CHW need to develop when they provide Medi-Cal billable services? And I think, Amanda, you might be able to answer this one.
Sure, I can take a first pass, and then Margarita, please feel free to jump in because I know that this is your your wheelhouse. But I think my understanding, and I'll put some links in the chat, is that our California Department of Healthcare Services, they ended up declining on creating one standardized CHW certification. However, they are requiring that the certification that the community health workers go through include those core competencies that we were talking about earlier. So in addition to taking that initial certification training, then community health workers, in order to continue to provide services, need to conduct 6 hours per year of training that are either related to those core competencies or specialty training. And so the state, I think, intended to have some form of continuing of both certification and continuing education, but has left that open to interpretation around exactly what that training looks like beyond the core competencies.
That's all true. And there was a new revision to the all-state letter in 2024, but it doesn't really change the requirements. It just provides more clarification. But in areas that, as a CHW, if the question also included what areas to develop as the CHW that is working in those billable services, I think that one that is critical is that documentation, because Medi-Cal being billable, it is about about codes, about, how many minutes did you spend doing this, and really understanding what are those billable services. And, a lot of times we provide so many more services that we don't really see it as a service. If you're providing education, if you're providing coaching, a lot of those are billing services that we just said, well, we met with the client and we talked to them about seeing the doctor, but we also coach them on how to prevent, their sugar levels to go up. And we talk to them about X, Y, and Z. So really understanding all of the services that are billable services under Medi-Cal, because we are already providing a lot of that service for those Medi-Cal providers, and those eligibility criteria under CalAIM is very, very specific.
That is so true. In many conversations that have come up, many of these activities that are billable, it's something that already the CHWs are doing. So how can CBOs access the CHW training, including continuing education? That's a good question. So do we have some resources? What are those access points?
Well, I know that the San Diego Wellness Collaborative, and I know that they're present, we're compiling a list of the various providers of training. I know that, not to be a commercial, but my organization provides training. Consulting Solutions LLC has the Community Health Worker Health Services Academy. I see Visión y Compromiso is also in the attendees. They also provide training. I don't really know if San Diego State University is still doing any of the trainings. No, I see Tanya shaking. No. So there were some trainings online that were being provided by some organizations. So I would say you have to kind of search, but I know that it is something that we were trying to compile a list of the various trainings that were available in San Diego. I have not found any of them to be free, unless an organization may get a grant and is able to put in some training for free, but I have not necessarily found any of them to be for free. I had heard that, and I don't even want to say if it's not true, but that Molina was doing some trainings online. So, but that one is not confirmed. But I do know that certainly Visión y Compromiso does trainings. I do know that El Sol, I believe, and San Bernardino, they do online virtual trainings. My organization, we do both online and in-person trainings here in San Diego County.
Okay. Thank you, Margarita. And I can say that we have been in several conversations with different partners that we were exploring how to keep this going so we can leverage that curriculum that was formed through the pilot. As you know, it went to different focus groups. Great partners contributed to the product. So if there's an opportunity that comes up, we'll announce it once if anything comes up, and we'll make sure that we use this network and distribution to announce the opportunity.
And it is important to understand that the training, there's a lot of training, right? There's training for just helping with soft skills, helping with communication skills, supervision. Mm-hmm. And those are all great trainings, and we can find some trainings here and there. So that may be enough. You don't need to go through the whole academy of training if there is no Medi-Cal reimbursement. So this is only required if your organization is planning to request Medi-Cal reimbursement for the work of the CHWs. Otherwise, you don't need to do this. You don't need to be a certified CHW to do the work that you do. So this is only required for those who are looking to do the billing, and that's a training that usually is more comprehensive and includes several components, and there's a cost to it.
That's a good point, Margarita. And for the continuing education piece, it can be for everybody as well, not only if you're in the certificate track, but if you're a CHW and looking for that continuing and enhancing your knowledge base. I know the San Diego Promotoras Coalition always has opportunities. There's different websites that come up with different trainings that align with those soft skills, that are aligned with the core competencies that you can leverage, and many of them are free. Okay, so the next question is, what fields or roles do you see the most opportunities for CHWs in San Diego? And how can people find about these opportunities? Anybody wants to take this one?
Sorry, did you say what are some CHW roles?
Mhm.
Okay, yeah, as I mentioned, I know that San Diego County Promotoras Coalition has quite a bit of opportunities for engagement, and I will be happy to add some information in the chat in terms of engaging. And the really cool part is that we have a reach in throughout the different regions in San Diego County. We have a community engagement committee where the promotoras are welcome to join and be part of that space and share and learn from one another, and also be part of the different efforts happening there. So I can definitely do that, and I can share that information in the chat in terms of like contact info and what are some openings that we currently have in our committees, if that's of interest. Thank you.
Like to kind of
Thank
tag
you.
team. Oh, sorry, Daisy.
No,
Okay.
go ahead.
So I do think another area that is, I'm at SDSU. I work a lot and partner with working with UCSD and the Alpha Clinic, trying to support some of their work. So I see that there is an opportunity growing for community health workers, promotoras, in clinical research and health innovation, especially around the community engaged and patient-centered research. The challenge is, right, a lot of these are grant funded, and so it's that ebb and flow, which is challenging. So what we're trying to do at SDSU's, the Center for Empowerment and Community-Driven Research, is build that capacity and partnerships, and we're actively pursuing funding to support CHW-led research models. So really trying to highlight and bring CHWs into that conversation, because they play such a critical role, right, in helping increase diversity in clinical trials, and doing that patient outreach, the navigation, the community education, advocacy, right? All the things that we know CHWs are just absolutely amazing at, but helping to ensure that that research is inclusive. So we're continuing to build. Unfortunately, we're not hiring right now, but definitely we would work closely with the Promotoras Coalition, right, to get the word out when we have those opportunities that would come up, and the County of San Diego as well. So fingers crossed on kind of helping support and develop that.
I also think that there is opportunity in the behavioral health field, both in the schools and LEAs, local educations with the Children's and Youth Behavioral Health Initiative. I think there's a lot of opportunity there for community health workers. And the San Diego Workforce Partnership also conducted a needs assessment, and they found that there is a gap and a need for more support in the behavioral health field. So I do think that that is a field that, with more opportunities that have opened up in reimbursement for the work of community health workers, I think that that will offer up a lot of opportunities. And we know that behavioral health issues increased after the pandemic. So I see that as an opportunity that opens up more doors.
Yeah, I'll echo, I think what Margarita was just saying about behavioral health. There's a growing area of need around opportunities for peer support specialists and individuals who, especially as we see our region, and I think it's true across the state of California and the nation, that we have a mental health crisis. We don't have the providers that we need to provide the support that our communities are asking for. And so community health workers and peer support specialists can play a really unique role in supporting some of those needs. From the putting my hospital hat on for a moment, we also see that a lot of the health plans are still ramping up and expanding their community health services as it relates to connecting to enhanced care management, ECM, or community support services, CSS. And so we anticipate continuing to see more opportunities, employment opportunities in those areas. And then I think there's a lot of opportunity for broader community health work efforts, right? And so it's not necessarily just about billable services, as I think a number of us have shared earlier, that we'll continue to see kind of promotora and community health work that's grant driven and maybe goes beyond those billable services that we're looking at right now.
Thank you, panel. I really appreciate. I want to thank everyone for joining us today. Unfortunately, that's all the time that we have for questions. I know there was some other questions about the length of the training academy, and in each training can look different hours, but the training academy for the way it's designed for the curriculum is 80 hours, but there's different models, different approaches with different hours. And there's also there were other questions about the links, not being able to access the links. We'll make sure we get the links from the chat and add them on a recap email. Thank you to a special thanks to our panelists for their invaluable insights and for the valuable time. I really appreciate you really taking time out of your busy schedule to spend this afternoon with us. We can spend easily another hour just talking about CHW work. So thank you. And now I'm going to pass it back to Lauren to tell us more about next steps.
Thank you, Jeanette, and thank you again to all our panelists today. Before we move on to announcements, we are going to ask if you could let us know what you thought about this webinar and the information that we shared today. We will also add this link in the chat, or you can scan the QR code to complete the short question feedback form. And just keep in mind there are no wrong answers. So we'll give 1 or so minutes for you to fill this all out, and then we'll continue on to our announcements. Great. Well, thank you everyone for taking some time to respond to the feedback form. We really appreciate it. It's very insightful for us. And we hope you enjoyed this webinar. So just to close this out, we have a couple upcoming events listed on our next slide. There are a couple coming up in May. We have one that is in person and one that is a webinar. The in-person event will be, and if we, I think, take a moment to get to the next slide, in just a second, it should show up. We have our smartphone policies and our youth well-being event, and then our webinar in May will be the data dialogues. And then in June, we will have a virtual career panel and also an in-person event on well-being and burnout. So for more information and to register for any of those, please visit our Virtual Connection Hub website. You will also receive a recap email with the recording from this webinar and a Q&A report. So thank you again, everyone. We appreciate you joining today and have a good rest of your day.